The objectives of this presentation are to evaluate ultrasonic assessment of the most critical and tenuous period of human development, which is the embryological life, to illustrate and justify the use of terms 3D Sono Embryology describing embryonic anatomy, to assess correlation between 3D assessment of early human development in comparison with morphological assessment of embryologists. So first thing we'll be discussing about embryo, the formation of embryo, its development, then how it appears on grayscale and with power Doppler, then followed by 3D or 4D. So mainly it is divided into three parts. We will discuss general embryology, then power Doppler comparison with the color Doppler or grayscale assessment, and then we will have few things about 3D, 4D in embryonic life. For background, we need to know that there are stages of human perinatal development. First 12 to 14 days is the stage of zygote. From 15th day up to 8th week is embryo. And from 8th week to the time of birth means 8 weeks and 1 day. The embryo is named as fetus. Why we change the name? Because the formation stage is embryogenesis. So we name the fetus as embryo till age of 8 weeks. So anything which need to be formed is supposed to be formed till the age of 8 weeks. And from 8 weeks, 1 day, the embryo is called fetus, which will be named as fetus till it is delivered. If we look at this diagram, you can see the corona radiata. And this is at the time of ovulation, the ovum. Here you can see the fimbria. Then the first day of fertilization, you can see the sperm entering into the ovum. Day second will be the first cell division, which is named as zygote. Then at day 3, traveling towards the endometrium is the morula, day 3. Then the blastocyst is day 4. And it is embedded here in the endometrium. When we look into the blastocyst, we can see the structures like there is amniotic cavity, and we have got a yolk sac, the primary yolk sac here, trophoblastic cells, and it is implanted. This surface is the endometrial surface. Then we have got the embryonic cells, which are of 3 types, the ectoderm, mesoderm, and endoderm. This is a stage of day 8 to 10. There are 3 layers. So these 3 layers are very important. The first one is ectoderm. The structures which are formed from ectoderm are the central nervous system, the peripheral nervous system, skin, hairs, nails, sebaceous glands, sensory organs, mucous membrane of the anus, mouth and nose, tooth enamel, the covering of the tooth, and mammary glands. Whereas from mesoderm, the sportic structure of the body connective tissues like the bones, cartilages, muscles, ligaments, and tendons, the dentin of teeth, upper urinary system like kidneys and ureters are formed from mesoderm. Similarly, the reproductive system, heart and circulatory system, blood vessels, lymph nodes, they originate from mesoderm. The third layer is endoderm, the innermost lining of the pericardial, pleural, and peritoneal cavities, lining of GIT, respiratory tract, tonsils, parathyroids, thyroid, thymus glands, lower urinary system. So all these structures which are mentioned here are formed from endoderm. The process is of 9 months, and in new era, you can say that it takes about 9 months to download a baby.